Good afternoon. I'm joined by Commissioner Ben Baker and Dr. Jeffrey Swine from our Milwaukee Health Department to report on today's update on what we have learned today with regard to the swine flu that has reached Milwaukee. The first news we have to report is that the case count remains the same. We covered no additional cases today. The city of Milwaukee has not uncovered any additional cases of the flu today. We are expending significant resources to conduct appropriate testing and to protect the public health. The leads that we had yesterday were two individuals who have been tested and are probable positive. We continue to have people on the ground following all these in terms of contacts they have had with other individuals. Today we've made the decision to close an additional Milwaukee Public School, that is Allen Field Elementary School at 730 West Lapham. A symptomatic child related to one of the two probable cases is associated with that school. I have just gotten off the phone with Superintendent Andrikopoulos, and he has already begun to set in motion contact for both staff and individuals who are involved with that school. As we stated yesterday, our priority remains public health. As a father, I want to assure everyone that I will make sure that our children can learn in a safe and healthy environment. Today's declaration by the governor will increase the resources, such as supplies and equipment, to local jurisdictions, and we thank the governor for that announcement earlier today. I also want to thank the private sector companies who have stepped forward and have offered their help to us as well. I know the public wants more information, and we are giving the information as we know it. So I will continue to do that, as will Commissioner Baker and others from the Health Department. And now I would like to turn it over to Commissioner Bevan Baker. Commissioner.
Thank you, Mayor, and good afternoon. Bevan Baker, City of Milwaukee Health Commissioner. I want to reiterate some of the things that the Mayor said. Certainly our case count remains the same. Our case follow-up is very vigorous at this time, and we know that things are rapidly unfolding. The additional order that was issued today was just as the orders that were issued the day before, to protect the public's health and to make certain that we put forth the strategies to curb the spread of disease in our community. We certainly do applaud the actions by other institutions. They've taken some proactive precautions to also curb the spread of disease in our community. I want to be clear that we've issued no recommendations at this time regarding the cancellation of large-scale events planned within the city. A lot of questions about that. I want to clear it up. Our focus is on the follow-up to these two probable cases, and any individuals who have come into close contact with them are showing symptoms consistent with swine flu, and those are where our efforts are being placed at this time. We've had a very robust response to our efforts to call our hotline for information. Over 500 calls yesterday and several hundred calls today, and we continue staffing that and will do so. The recommendations that we've issued regarding encouraging any person in Milwaukee who has symptoms consistent with influenza stay at home or from work or school and contact their health professional still exists. Those recommendations are for everyone. Let me repeat, for everyone, regardless of your travel history. Travel history at this time is not a rate limiting factor. It remains important, again, for all individuals to exhibit good hygiene and the frequent hand washing, which has been said many times, and to understand that the symptoms of fever, cough, sore throat, runny or stuffy nose are those things we want to look for. I want to assure you that we're working with our state partners and our federal partners as we follow up all of our cases. And we take the guidance from today's declaration, which will make assets available to this local health department and will enhance our power to respond not only rapidly, but very thoroughly to the growing concern with this global outbreak. Lastly, I want to make it clear that over the last 3 or 4 years, our pandemic influenza preparedness plan has been tested. This is not a test. We have a very good plan, and we're responding to every element of it this time. I want to emphasize that our investigation will grow rapidly and change daily here at the local level, the regional level, and the national level. And these recommendations that we give to the community daily are to curb the impact of disease. This is all of our concern. This is all of Milwaukee's concern. And together, we can get out in front of it. With that being said, I'll turn it back over to Mayor Barrett to take a few questions.
With respect to the schools, over the weekend, we will reevaluate each of the schools as to when they can reopen. And it is our hope that as soon as there is clearance from a medical standpoint, we will reopen those schools. If there are any questions, we'd be happy to answer.
What can you tell us about the two patients? How are they doing and what's their prognosis?
We are in direct contact with the healthcare providers of those individuals because their health information is protected under Privacy Acts. We won't discuss that. But we do know that all those individuals who have been identified as either close contacts with these probable cases are receiving the appropriate follow-up from healthcare professionals. And we believe that the two cases are receiving the best case that Milwaukee healthcare professionals can provide. But we won't offer any guidance regarding their health information at this time.
But I think we can also add that there have been no problems with non-cooperation.
Do you have anybody on preventative medications taking Tamiflu proactively, and if so, how many people?
Certainly, we are in a position to make certain that antiviral medication is available to those who are either in treatment or have been in close contact with individuals who are currently in treatment. And that information is been shared with appropriate healthcare providers, and they do have access to those medications. We are in receipt of the antiviral medication here in Milwaukee, and it's made available and being made available to those who are in treatment or are in contact with individuals who would suggest that they need prophylactic treatment. This treatment in advance of them showing symptoms. So we're pleased that the national stockpile has been released and that the state of Wisconsin has put those assets on the ground here in Milwaukee.
Do you have a number of how many people are taking those preventative antivirals?
What we know is that as our case follow-up continues and we identify information where it leads us to individuals who are symptomatic, they have access to it. That number is not fluid, it is changing daily, but we do know there's adequate supply of medication in our community.
The governor has said that there are several of the 5 cases in the state now are related to travel. Can you tell me if either of the Milwaukee cases are related to travel?
What we can say is that our index case, or the first case and the second case that we call probable this day, we're following up and we're looking at that. While travel history may come into play for I believe what was stated earlier today by the state, 3 of the 5 cases, we understand that disease is circulating in our community. And again, travel history is not a rate-limiting step. The disease is here, and you should not just look at travel as a concern. You have to understand that the disease is here in contact with someone who's been impacted by swine flu is what we're focusing on.
So what needs exactly to be investigated though? Because isn't it pretty clear-cut, the person went to Mexico, came back? I mean, or is Mexico not being looked at? Like, I'm just kind of clarifying.
Well, certainly we're taking that epidemiological data. We're taking the fact that travel history is a concern and may have impacted 3 of these 5 cases. What I'm trying to make clear here is that we now know that we have probable cases throughout the state of Wisconsin. And our follow-up is on contacts that may have presented concerns to any part of our community. And we want to make certain that whether you went to Mexico, whether you know someone who went to Mexico, if you are exhibiting those symptoms consistent with swine flu, you need to stay at home from work and contact your provider. So that's all part of our investigations, but that is not where our investigation starts or ends.
So then are either of the 2 cases in Milwaukee included in the 3 that?
That information is not germane to our message at this time. It's part of our investigation. The message here is that we want the public to take the precautions necessary to curb the spread of disease. We are getting that data, and we will provide more of it as it becomes necessary, but it does not change the message that I'm delivering today.